and I'll make you a spotlight. Good evening and good afternoon, everyone. Today we have with us one of the world's eminent scholars in information systems and technology from the New York University, Professor Anindya Ghosh. Professor Ghosh is going to join us today in the CMHS Healthcast podcast. He is the Heinz Riehl Chair of Professor of Technology and Marketing at New York University at the Stern School of Business and holds a joint department in a couple of departments in that university. He's author of a very blockbuster book, if you want to call it that, TAP, Unlocking the Mobile Economy, which is a double winner of the 2018 Axiom Business Book Awards. He also is the director of the Masters of Business Analytics program and also the Leonard Stern faculty scholar with the MBA scholarship. Several other accolades you can look up on his website. Um, One interesting piece of news is that Dr. Ghosh and myself share our same grad school, so both went to Carnegie Mellon. So it's a great opportunity to have Professor Ghosh with us today, and I would love to chat with him today on his two recent papers on digital health and physician and patient behavior. Dr. Ghosh, thank you so much for joining us in the conversation.
Chirantan, great to see you again, and thanks for having me. Looking forward to our chat.
Thank you, Anindo. Since you called me by my first name, I'll just switch there.
Absolutely,
Um,
yeah.
all right. So, Anindo, why don't we start with your wearable device paper? What did you find in that paper, and why are you so excited about that paper? Can you just
Yeah,
walk us
so
through that a little bit?
absolutely. Yeah, you're absolutely right. I'm super excited about this paper, not just because it took us 5 years for us to publish it, but because I truly believed in the research question and its application. So, here's what's going on. For the last 5 years, 6 years, since we saw the advent of wearable devices that people often buy, like an Apple Watch or a Samsung Watch or a Fitbit or a Jawbone, right? People have been really, spending time trying to figure out if the adoption of the devices is actually causing any changes in the lifestyle of
Mm-hmm,
people, and is that actually resulting in any concrete positive healthcare outcomes? Okay,
mm-hmm,
because we've heard this buzz about wearable devices for a really long time, but there's been no work done that actually quantifies whether or not these devices and these apps on
mm-hmm,
your smartphones that are, health apps or nutrition apps or fitness apps, are they actually making people change their wellness behavior, right?
mm-hmm.
So this is the question we wanted to answer. We wanted to see if people are actually making changes in their short-term behavior, in what they eat, how they sleep, how they exercise,
Right.
etc. And in the long run, does that actually help, for instance, the patients of chronic diseases like blood pressure and sugar and diabetes and so on? Okay. And in even a longer run beyond that, you can imagine looking at healthcare consequences such as doctor visits,
Mm-hmm,
insurance costs, medical expenses, etc. So, I that's the reason why my co-authors and I were really interested and excited about this project. And I should mention that I have a couple of co-authors, Professor Bailey, who, by the way, is a professor at Carnegie Mellon in Heinz,
correct.
where you also went, and Professor Shitong Guo, who is a professor in Harbin in China.
Excellent. So, what was the experimental design? I'm intrigued that after 5, 7 years of wearable designs, nobody used observational data. Or what special did you do with your experimental design? That would be pretty cool to learn.
Yeah, so you hit the nail on the head. Why didn't people use observational data? Because you will then face an immediate self-selection problem, right?
Right.
What will happen is people who use the device will then self-select into actually exercising more and eating better and sleeping better. And so any positive outcome you see from those patients is essentially, you can't disentangle what is the effect of this adoption from just natural self-selection. And so that's why, when we started looking into this in 2016, we decided to partner with the largest healthcare app platform in Asia.
Mm-hmm.
This app platform essentially focuses on chronic disease patients like, diabetes and blood pressure and sugar and so on. And we designed and essentially executed a very large randomized experiment in which essentially, we will have the usual treatment and control groups, randomized, of course, with the control groups not getting access to these devices or these mobile health apps, and multiple treatment groups. The first treatment group will have access to the mobile version of these wearable apps. A second treatment group will have access to the mobile version, plus they will get a generic reminder every day about their exercise activities or food, nutrition patterns or sleeping habits.
Mm-hmm.
And a third treatment group that will get a personalized reminder. Okay.
Mm-hmm.
And so between the two control groups, the one that doesn't get any intervention and the one that gets the intervention on a desktop, comparing them with the three treatment groups, we were able to disentangle the true causal effect of the adoption of these devices.
Mm-hmm. And we would have an audience here who probably might be doctoral students, and like in India there is a lot of activity on technology and healthcare these days. So
Right.
one thing that one would love to build on your work, I'm sure you guys will get a lot of citations from this paper as a result of being first in this space, is that how to navigate the ethics board clearance. So I have myself done an IRB on certain context, and it seems like you get these weird questions, you don't know how to respond to that. And I'm sure doctoral students, if they want to design an app or something like that and see its causal effects on health outcomes, will also run into this. It would be nice to share from your side how your research team dealt with it, and if there were issues that arose from the IRB and ethics clearance issue, because the control group didn't get the treatment, right? So how do you respond? I'm sure IRB might have raised a question there, and how was your response there?
Yeah, so broadly at the very high level, one has to make a distinction between data that is automatically recorded by health apps and smartphones and data that is actually self-disclosed by patients. Okay, so
Mm,
in our context, that's a very important distinction. I'll give you an example. When people are running as an exercise or when they're walking, that is data that is automatically recorded by the app,
mm-hmm,
especially because these apps and the smartphones have gyrometers, accelerometers, etc. Right? And then there's another kind of data, such as changes in your glucose level on a daily basis, changes in your cholesterol level, changes in blood pressure,
mm-hmm,
or even like what food are you eating and what is the actual calories in that food consumption. Those examples of data that are actually self-disclosed, okay, and sort of
I see.
self-recorded and uploaded, right? And so, that's the important distinction to be made. As a researcher, for any sort of clearance, you have to make that distinction. The second issue is then, patients have to be informed ahead of advance,
Right.
what data is going to be collected and, at least broadly how it's going to be used, right?
Mm,
You cannot be very specific because when you're designing a field experiment, yeah, you have to observe the effect of the intervention without seeding any ideas in their mind.
mm-hmm,
So in our context, for example, when we recruited patients, we essentially did it through both offline and online channels. We looked at newspapers, we looked at online social media sites, we looked at physical, flyers being sent to hospitals and other sort of, medical institutions. It was a combination, and in those flyers, we had one uniform message that if you decide to participate in these experiments, here's how this will happen. You will be given a free device.
mm,
We will be asking you to upload your data on a daily basis for a certain period of time. And as a consequence of doing this, you would be eligible for a lottery, like a raffle prize.
mm-hmm,
Okay? And we are essentially telling them that you will be observing your behavioral, physical, physiological data. So there's full transparency. The patients know what they're supposed to
informed
do.
consent, yeah.
Exactly, it's informed consent. So that I think that is critical
Mm,
to get any sort of to make sure that you've done it right.
mm. And did the reviewers trouble you with the fact that this is an Asian population, may not be valid if you take it to an European population? They are more fidgety about your data and privacy and health issues and all that, like
Yeah, not really.
external
Actually,
validity. Yeah.
Yeah,
External
no,
validity issues. Yeah.
we didn't face any such issues. And, I mean, in these days in business schools, journals, as I'm sure you know very well,
Mm,
right?
mm,
It is already very well known that institutions overseas, as in if you are in the US, institutions or companies overseas are far more willing to participate and collaborate with you on studies
correct.
than many Western companies for kind of reasons you mentioned. So I think maybe 10 years back that would have been an issue, but not today. In 2020, working with companies in Asia and India, Korea, China, Singapore, Japan, it's not really an issue. Specifically, if you can, identify a question that is, broad enough,
Correct.
so that despite the fact that you're looking at maybe a handful of nationalities or ethnicities, the insights can be generalized beyond that local population, right?
Correct.
Um, yeah,
So what do you find? Finally, what are the results like? I mean, what's
yeah.
your
So
headline result?
yeah, absolutely. So
I'm sure the Economist is soon going to pick it up, and you're going to be the new superstar scholar who is providing evidence on this. So why don't you share that with us
well,
before
I
the
don't know
Economist
that,
gets it?
but I hope so. I hope so. We'd be very excited if that happens. But yeah, so we have short-term results and then we have long-term results. So the entire experiment spanned over a 15-month period, okay, across almost 2 years. And we find that in the short run, people are doing three things. First of all, they are exercising more in terms of walking or running. Number two, they are eating better. They are more calorie conscious. They're eating better. And number three, they're also then the consequence of eating better, sleeping better, and exercising more is their chronic disease symptoms start to reduce. We find a statistically significant effect of the intervention of all the three groups on a drop in glycated hemoglobin, in blood glucose, the kind of diabetes related chronic symptoms. Okay. So we definitely find that in the short run, there is that strong effect. And then in the medium slash long run, we find that they are actually reducing their doctor visits, actual physical visits and hospital visits. Consequently, there's a drop in medical expenses because obviously you're not incurring as many expenses. And then C, a fraction of those who drop who are healthier, and that's why they don't need to visit the doctors or the physicians as often. Some fraction of them are actually replacing offline physical visits with telehealth. So that was a really exciting piece. We saw the move from offline to online. We could track that, right? Because this is an online platform. A fraction of patients, especially those who are getting these personalized reminders,
Hmm.
yes, they overall were healthier and they were, a lot more, wellness and fitness conscious and food conscious and health conscious. And in addition to that, they also started replacing their offline visits with online. And the interesting thing is this is happening before COVID. So, and
Hmm.
we are also excited because this is one of the first papers to show this substitution between offline and online channels in the healthcare space. And as since you study healthcare as well, right, we are also excited about that result.
So that makes me intrigued on the competitive response if those results are where they stand, because now the pharma companies will say, hey, you're not consuming my statins that much more. So do I need to now create these apps and become a technology firms? And the physicians might say, I lose my business, right?
Mhm.
So any thoughts there on the crowding out effects as the substitutions happen?
Yeah, so we haven't looked at that. It's a great question. We haven't looked at that per se. Here's what we saw. So yes, there is some crowding out because people are getting healthier. Now, in a general, you would say that okay, that's a good thing, right? If chronic disease patients are having to less frequently visit doctors
Hmm.
or blood pressure or diabetes or cholesterol, so society as a whole is getting better. A. B, there is some substitution, right, between online and offline. If the prices remain the same, then there's not much of an impact on physicians, right, for those people. However, you could argue that I think the future of telehealth is probably going to have, some drop in the physician fees when it's online versus in person, right?
Correct.
Part of that is duration. When you're doing this in person, what is
Yeah.
20 minutes in person might become 10 minutes online, for
Right.
instance. And I think it'll probably have some downward effect on pricing. And I think it'll be interesting to see, how the entire healthcare ecosystem reacts to it.
Mm.
For instance, maybe now we get an influx of new patients who've never really enrolled in healthcare plans, but now with online, with
Correct.
reduced pricing, you get a volume effect, right? So there's like higher sort of, increase in overall patients. But I think there's multiple possibilities here, and we just have to wait and see how that
Mm.
unfolds.
Yeah, and you can also add like these ideas on precision medicine also here by capturing some genetic data to correlate with their health outcomes and having targeted therapeutic interventions on patients using such a app. Okay, that's great. Normatively, then, what's your recommendation to the policymaker? Because I'm presuming that these are being created by private entities. Do you prescribe that make it public? Yeah, yeah,
Yeah, no, that's a fantastic question, right? So, look, we actually in our research we did collaborate primarily with private institutions, hospitals, doctors, clinics, and there because it was Asia, we had some mix of public healthcare institutions as well. But here's our study has one straightforward, I would say, public policy recommendation and one sort of a complicated one. Okay, and I'll tell you the first one is the easy one. The easy one is if we are seeing that after about a 15-month period, there is statistically significant effect,
mm,
that is, people are changing their lifestyle and wellness behavior, especially chronic disease patients, and they are in fact benefiting from a reduction in chronic disease symptoms, then I think you could argue that there is a need for public policy intervention to kind of disseminate wearable devices at reduced cost with
correct.
subsidy so more and more people can adopt it, right? And I think that to me is a much more straightforward implication. The parallel I think is people will say, well, wearable devices are expensive. You
Mm,
don't really need like an Apple Watch for this, right?
correct.
You can essentially, just like how smartphones proliferated, we didn't need the
Exactly.
$1,000 Apple phones. You can have a $50 phone, and it will still do a lot of the same work. So,
Exactly.
we definitely see an opportunity for government and policy institutions to, really heavily subsidize the adoption of these devices since we are seeing people are going to be conscious about it. So I think that's an easier implication. Now, there's a follow-up to this. The implications of all of this on insurance companies, that to
Mm,
me seems complicated, right? And
mm,
here's why. When I started presenting this research in more broader, non-academic, more managerial or corporate forums, the one thing that stood out was insurance companies were very interested in like
these
our
devices.
models, our algorithms, our the experimental design, because they said,
They want
look,
to solve adverse selection. Yeah.
yeah, exactly, right? So what would they do? They will basically want to penalize the guys who are not exercising, not eating well, not sleeping well, and then reward the people who are exercising and sleeping better and eating better, right?
Correct.
Now there is a fundamental sort of an ethical dilemma there because
Mm-hmm.
why? We know that income is highly correlated with the ability to exercise and the ability to eat healthier and the ability to sleep more. As in, rich people, they
Mm,
have the luxury of time, they have the luxury of money, so they can exercise more, they can eat better, and they can sleep
mm,
more.
mm,
And the poor cannot.
mm,
So we don't want to see a world where the rich get rewarded for being rich and the poor get penalized for being poor,
mm,
right?
mm, mm,
And I think that's the fundamental problem that we need to figure out a way where our research does not get sort of commercialized with inadvertent but negative consequences. We don't want that to happen. And so I think the next step for us is, and I'm definitely interested in having conversation with policymakers about how to take this benefit of wearable device adoption, but given that it has immediate healthcare outcomes and obviously medical expenses and insurance implications,
mm.
how do we do this in a way where we don't have the Matthew effect, we don't have the rich get
Right.
richer effect?
Right. Very, very thoughtful that. Yeah. Maybe this is a good time to then segue to your other paper, which is online reviews and physician demand. So like a quick summary, where's the contribution, and uh, maybe for PhD students listening, stuff to do building on both these papers going forward. Some open questions that would be nice
Yeah,
to
sure,
chat
certainly.
about. Yeah.
So the other paper that I'm excited to talk to you about is, joint work with one of my colleagues, More Harmoni. She's now a vice chancellor at NYU, and one of our joint PhD students, Yuki Anshu. She is now an rising star as assistant professor in University of Illinois at Chicago. So here's what we did, right? So as I'm sure we all know, right, online reviews have been an important gatekeepers for patients to figure out which doctors to choose from. Okay.
Mm-hmm.
And in the post-COVID world, in the global pandemic effect, right, as I was saying, telehealth and online health can become more and more important. We thought it would be really interesting to analyze online reviews for doctors from a leading medical appointment booking platform
Mm-hmm.
to understand patient choices. How do they choose physicians and hospitals and doctors? Okay. And so the broad idea is we are using text mining and machine learning techniques and deep learning techniques combined with econometric and choice modeling techniques
Right.
to examine what are the attributes of these physicians and doctors that affect their demand. Okay.
Mm-hmm.
And happy to elaborate more on this.
Okay. So if I title this session as a tale of two papers on technology and healthcare, what do you
Mhm.
think are the big open questions and grand challenges in that space for people to
So
pursue?
yeah, no, definitely. And so maybe I'll start with what we find, right? And then I can tell you more about like, what I think are open questions. So first of all, our takeaways are A, patients definitely rely on textual reviews of physician services to make their choices. Okay. So our paper identified the 7 most frequently mentioned service features of physicians and doctors. Number one, bedside manner. Okay, what's the
Mm-hmm.
bedside manner of a doctor? Accuracy of diagnosis. Number two, waiting time in the doctor's clinic. That's a big pain point.
Mm-hmm.
And service time. Okay,
Mm-hmm.
these four were the most statistically and economically significant attributes that influence patient choices of doctors. Okay, who they visit or not. Okay. And so the implication of this is, predict these kind of predicted models of patient choices can help doctors much more efficiently manage the operational aspects of their practice, right? Like if you know that waiting time is, far worse than service time, the negative effect of waiting time is worse than service time, you know how to allocate your time as an example, right?
Correct.
So, we definitely think that although we started scratching the tip of the iceberg, there's a lot more work that can be done to promote figure out how to promote better long-term relationships between doctors and physicians. Okay.
Mm-hmm.
um, Look, I mean, again, I think with the uptick in telehealth due to COVID-19, we know that individuals are using digital platforms to choose doctors and healthcare providers. And
Mm-hmm.
I think, we've only done the first, preliminary work
Mm-hmm.
examining how reviews can be informative, what features can be informative. I think as we see more and more volume of online or telehealth adoption,
Mm-hmm.
there's a bunch of other questions that are opening up. Are there, what is the relationship between a given patient's online versus offline visit? Are the substitutes of the complements, right?
Right.
Like now we've seen this in banking. Like when people
Right.
started doing online banking, they actually did not reduce their offline visits; they actually
Right.
increased it.
Right.
So I think that to me is like a very interesting, space where just going back, to
Mm.
the 15, 20 years to the world of e-commerce,
Mm.
we know that this whole relationship between online channel and offline channels became like, thousands of papers were written on it, many of them really good papers, right? We know that the effect of online reviews on sales
Mm-hmm.
became a discipline on its own, so to speak. So I feel like as healthcare opens up to the telehealth space, we're going to see similar questions that need to be answered. Okay? So I would say, for the PhD students who are going to listen, here's what I would recommend. Okay, think about two of the biggest barrels to healthcare. So we've got e-commerce and we've got banking and financial services. Go back to Google Scholar, look at the classical papers, the earliest papers in e-commerce and financial services, and then see as individuals started moving from offline to online or online to offline, what are the questions in those papers? Healthcare is going to go through a similar disruption.
Hmm.
So why not start to think about answering similar questions in healthcare?
Very,
And
very clever.
right? So I think that's how I would go about it.
Very nice. Okay, we are at the end of our conversation almost. So, any concluding thoughts from these two sets of papers for policymakers, for the entrepreneurial and farm ecosystem, broadly for
So
society at large? Yeah.
definitely. So so I talked about the implications from the first paper, right, for policymakers. So maybe I'll talk a little more about the second one.
Hmm.
So clearly, on the managerial corporate side, there's a bunch of implications for platform design, right? So to me, the biggest bottleneck or the biggest impediment that a healthcare platform has to address is how do you incentivize users to write reviews in the first
Hmm.
place, right?
Hmm.
Uh, Now, we examined the effect of reviews and we showed that it can be very impactful, but how do you get users to write reviews?
Right.
Because in the retail e-commerce world, maybe 10, 12% of people at most write reviews, and that fraction is a lot lower in healthcare as of now. So I think I can imagine questions about using experiments to incentivize users. Like, should you pay them money to
Hmm.
write a review? Should you offer some sort of social proof, like social capital, to write reviews? Should you do a combination of both? Maybe there is creative content, creative email reminders that can go to patients to incentivize them to write reviews. And there's in the IS field, there's already been work in these kind of questions. Again, in the e-commerce space,
Hmm.
and I think again people can borrow from those papers and think about experimental designs for incentivizing users to create content on the internet. In the form of reviews, so that others can benefit from it, right? So I think there's clearly platform design related issues there.
Okay. Any final thoughts, Anindo? Thank you so much for your time. I know you have to keep a busy schedule, but we really appreciate your thoughts here.
Oh no, thank you. Thank you for the opportunity, Chirantan. It's always good to talk to you. And I'm especially happy because we are reconnecting after a really long
After a
time.
long time. Yeah.
And these days I'll take a Zoom call, over pretty much anything because that's the best we can do. But listen, I know you and I have talked about whenever in the post-COVID world we meet in India, we should try to meet in
We need to
person.
catch
And
up. Yeah.
if I can swing a trip to Ahmedabad while you're there, even better.
Awesome. We look forward to hosting you in campus for sure.
Thank you.
Thank you
Thanks.
so much, Anindo. Take
Thank
care and
you.
stay safe. Bye bye.
Thank you. Bye.